Hello, everyone. A warm welcome to this session on promoting gender and inclusive development through innovations and health financing. I'm Kavita, Manager Knowledge and Member Engagement, AVP in India. It's great to have all of you with us today. AVPN is a network of funders and resource providers with over 600 members across 32 markets. Our mandate is to move more capital towards impact in Asia by providing social investors like yourselves opportunities to connect, learn, and lead. I'll be your MC. My role is to ensure that your experience in the next hour is a meaningful one. If you find that my voice or the video is lagging, it may be due to the internet bandwidth issues. It may help to log out and log back in again. If you are facing other technical challenges, such as difficulties in hearing the speakers, please do not hesitate to type in the chat box. We will address your queries as soon as we can. Before we kick off our session, I'd like to highlight a few features of this room. Please note that this session will be recorded and you will be able to access the recording from conference.avpn.asia in the next 24 hours. We will have dedicated time for Q&A at the end of the discussion, so do stay with us until the end. You can ask questions even as the panel discussion is on. Feel free to type your questions in the Q&A box and we will convey these questions to our speakers. You can post your questions anonymously or with your name on it. You can also upvote questions posted by others if you like that question to be answered. Upvoted questions will have higher chances of being picked by the speakers. Due to time constraints, the speakers may not be able to respond to all your questions. Rest assured that we are monitoring this behind the scenes and we will take and try and address as many as possible. At the beginning and at the end of the session, you'll be able to participate in polls and I will be on standby to guide you through those. Finally, to continue chatting with your speakers and fellow delegates in this session, please make full use of the AVPN connector. The link will be posted in the chat. A quick 1-minute tutorial can also be found on the main conference site to make full use of your networking opportunities. Before I hand over the stage, we would like to get to know our audience better. Please take a minute to fill out the poll below. It's wonderful to see that 78% of the people in the room are from Asia, and we equally have 12% people from Europe and 3% from Africa and 7% from Australia. That's really wonderful to know. And how does your work relate to healthcare? So 36% of the people have said that they are into implementation and consulting agency. And 34% say they are impact investors and grant makers. And 11% are entrepreneurs and 19% are policymakers or academia. That is so interesting. On that note, I would like to introduce you to our moderator. Our moderator today is Amrita Agrawal. Amrita is National Lead Health System Design at the India Country Office of the Bill and Melinda Gates Foundation. She is engaged in the health financing and service delivery change programs at the national level. She's also leading the private sector engagement effort, looking at the demand and supply side barriers and innovative platforms to overcome these. Over to you, Amrita.
Thank you, everyone. Thank you, Kavita. It's great to see you all in this webinar. Today's topic is going to be about gender empowerment and the role of innovative financing and blended models to lead to uh, women empowerment, especially for their health needs. And we all know that this is a very important topic because there are many, many gender differences across men and women. And partly some of the gender differences are driven by reproductive health needs, but partly also because the different roles women and men play in the responsibility towards caregiving, uh, especially women who are providing caregiving without pay. This session will explore these facets and look at how various innovative health financing models exist. And we'll be talking to financiers who have been having extensive experience in this field, not only in India, but across the world, uh, ranging from Asia to Africa to other markets as well. We'll be looking at the needs of the women for healthcare, not only for as patients and population groups, but also as entrepreneurs. So I'm quite excited and very much looking forward to the panel we have and looking forward to the discussion. Before we go to our panelists, a few things about myself and the Gates Foundation. So Bill and Melinda Gates Foundation has been extensively engaged in broader healthcare strengthening, as well as specific areas on how to empower the gender health, women health across multiple markets. There are multiple ways in which we approach this. The three primary lenses would be to look at the one, the specific needs of women, maternal child healthcare, family planning, and these we approach not only say national level in India and state level like UP Bihar, but also in Africa and other markets as well. The second lens in which we approach women empowerment for healthcare and other needs is really through a dedicated gender program. So in 2019, Gates Foundation has embarked on a specific gender empowerment program, and this is an effort which spans multiple objectives, including financial independence. Lastly, it's not so much about gender empowerment and specific needs of the maternal child healthcare areas which are specific to women. This year onwards, we are focusing on bringing a gender lens to all our health programs. And these health programs, are the full gamut from nutrition, infectious diseases, overall health systems, strengthening, and including looking at the needs of the frontline workers and the self-help groups. So empowering both the ASHA workers as well as the communities like Jivika, etc. So multiple ways in which this important task is looked at. Uh, I'm very much looking forward to the multiple other ways other organizations are exploring this. So I think we should just now turn to our panelists who you're here to hear. So I'm going to quickly introduce you to the panelists which we have joining us. So first, I'd like to invite and introduce you to Tom Kegra. He's the investment director at LGT Venture Philanthropist, and he has been deploying philanthropic capital across many organizations and companies which are looking at creating innovative and effective solutions which are scalable for both social and environmental changes. He has been in his role looking across the whole life cycle of philanthropic investments from sourcing all the way through to the exit. The second panelist who are joining us is Dr. Prem Kumar Pillai, the Chief Medical Officer of Pure Land Global Venture. Dr. Prem has been helping and leading medical transformation in technologies and across a whole host of health services areas, especially fronting the medtech innovation globally and in Asia specifically. His current activities are as an entrepreneur in medical devices, but also as a mentor, advisor, investors to multiple healthcare startups. Lastly, but most importantly, we have Dr. Neeta Rao joining us. She's the senior health specialist from USAID. Neeta has been a public health specialist for 16 plus years. She has a diverse set of experiences on health financing, research, evaluation, policy formulation. At USAID, she leads the effort on health financing and innovative finance, and how can this address the development challenges which exist. So welcome to all our panelists. It's wonderful to sort of have this discussion with you. Um, so I think we should begin now. So first, I would like to begin by inviting Tom, who's the first speaker. And Tom, given your background where you've really seen digital innovation scale up across multiple geographies, we have a few questions we'd like to explore with you. How have you seen technology to be a catalyst for innovative solutions, meeting the needs of women's health across developing countries like Africa and India? Do you see a growing opportunity for this space to flourish? And what are the enabling factors from government, entrepreneurs, and the environment which will help bring in more blended capitals to this space?
Yes, thanks, Amrita, for the questions, and thanks for AVPN having me on this panel, and thanks for great listenership. Welcome, everyone. Yeah, so very briefly, my name is Tom Karger. I'm Investment Director at LGT Venture Philanthropy. We deploy the philanthropic funding of the princely family of Liechtenstein, and we are aiming at supporting organizations that have scalable solutions, as Amrita mentioned, to really help them strengthen their organizational capacities to bring organizations at scale, at quality. And to come to your question, Amrita, I think, yes, technology has a very important role to play in bringing more equity into healthcare services. I think we see a huge potential in driving scale and quality of solutions, but at the same time, we also see a great opportunity to really lower the shortage of healthcare workers by digitally equipping new community members with tools that can help them to really transform healthcare in remote communities. And if we look at our portfolio, and you mentioned we do this not only in India, but also in Africa, I would like to just highlight a few organizations where that becomes really clear. So one is Mothers to Mothers, which is an organization that's actually the largest deliberate employer of HIV positive women in the world. So around 10,000 so-called mentor mothers work for Mothers to Mothers, and they work on reducing or lowering HIV transmission from mother to child. And for them, technology is a huge enabler to have both the mentor mothers better informed, but also to work with their clients. So one specific example is that they use technology to really follow up and remind people to take their HIV drugs on time and frequently. Another organization in Africa is Last Mile Health. Again, using technology to equip these community health workers with scripted analytical features that help them to diagnose diseases, the most like killing diseases in Africa, like malaria, like pneumonia, like diarrhea, based on these tools. So reaching actually 80% correct diagnosis by these health workers, and their technology plays a huge role. So coming to India, an organization that we lately worked with closely is Arman, and Arman is using pre-recorded audio messages to be sent out to pregnant women and new families in order to help them with maternal and child health issues. So here again, technology is really important. And then I mentioned like scale is one area where we think it will be transformative. I mean, Arman, for example, aims to reach 100 million people in collaboration with the government over the next 10 years. Mothers to Mothers is enrolling 3 million clients in 11 sub-Saharan African countries by 2022. So these are numbers for single organizations that are quite staggering. Without technology, they couldn't be achieved. Quality, I also mentioned, is really important. Really important aspect. And last but not least, the empowerment of women. So if you take the case of Arman, where messages are sent to women that live in very remote areas, have hardly any access to information, and through enrolling in Arman's solution, it will, this pregnant woman have all of a sudden access to a whole new set of information that she can use for her own health and also the health of the baby. But then in addition to that, we think technology needs to be embedded in systems. So the tool itself will not fix the problem. So training, capacity building, both of health workers as well as from government supervision, the whole institutionalization of these tools, of these technologies in the healthcare and the public healthcare system, I think is something that is really critical from my point of view. And yes, there are challenges. We see that there's still a very unequal use of phones or access to phones in India. So it's still primarily men who have access. So that's definitely something that we need to understand better and work better with. But overall, we see a huge potential. And Amrita, you asked for the opportunity, and I think if there is one positive thing of this COVID situation, then I think that it's surfacing the need and the opportunity and the potential of technology. I mean, one example is Prackle Foundation based in Africa, who were invited by the WHO to bring their tool that they developed in Africa as part of the Mom Connect project with this South African government, to use the technology platform to bring information, reliable information to the world, basically. So that COVID response information is now running through the WHO. It's translated into 7 languages using WhatsApp and Facebook, and has really the potential to provide reliable, trustworthy information that can be life-saving to over like 2 billion people around the world. So that's just like one example where the opportunity is opening up. And I think with increasing technological opportunities, with an increasing adoption of mobile phone technology, but also with an increasing literacy rate in India, and the adoption of technology will be crucial in order to drive equity and quality healthcare going forward. And I think the last question, Amrita, before I hand back to you, is around enabling factors for innovative financing. And we just conducted a study together with COIS, an impact finance firm out of India, to understand the opportunities in primary healthcare for innovative financing better. And I think one realization was that if you look at public-private partnerships, that in the past in India in health, they have been too focused on the inputs and not on the health outcomes. So I think if we talk about barriers or enabling factors, I think a real mind shift is necessary in order to have stakeholders think more about how to drive and how to pay for health outcomes and rather inputs. Secondly, I think what we realized, there is a huge need for blended financing. I mean, like we need grants to train community health workers. We need equity investments in order to drive innovation of social enterprises. We need debt for working capital to buy stock or conduct services before they get paid by the governments, and we need instruments like leasing to lease medical equipment. So I think that there's like a strong need. But what we need is really a conducive environment where different stakeholders like the government, funders of such vehicles, the entrepreneurs on the ground, like are interested and are working towards such instruments. I think we really need like a specialist with blended financing instruments that know how to set them up, because they are complicated. And last but not least, I think we need investors that are really keen on providing the upfront capital and structuring such instruments, because it can be quite a lengthy process before these blended financing instruments are ready to really drive healthcare and then contribute to more equitable healthcare delivery in India. So I think these are some of the thoughts that I have for your questions, Amrita, and I would hand over to you.
Thank you very much, Tom. It's been very, very insightful to learn from global experiences. I would now turn to Dr. Prem to bring in his experiences from Asia and to help us understand how have been innovations been scaling up to meet the needs of women in mental health care, in maternal health care, in cancer care, and other areas of women's needs, and what are the opportunities which you're seeing in these areas?
Thank you, Amrita. It's great to be here at this conference and share what we have learned over many years. I represent Pure Land Global Ventures. I'm the Chief Medical Officer and Advisor. We are very focused on impact investing, particularly in the healthcare arena. The aim is to let poor people globally have the same quality of care and same access of care as the wealthy. And we're very focused on what we term first mile care. The last mile care is high cost hospital tertiary care. And unfortunately, global resources in healthcare, if we even look at the number of doctors for the population, particularly in large parts of Asia, India, Indonesia, sub-Saharan Africa, parts of South America, we will never be able to train enough doctors, specifically specialists, to help mothers and children globally. So that gap, that supply-demand gap, is something that we feel at Pure Land we want to address so that we can basically democratize the whole process. And one way is looking at the first mile of care. The first mile of care starts in the home, outside the hospital, around the community that a person lives in. And this, of course, is sorely neglected. And if we look at one of our major interests, which is maternal and child care, if you look at global maternal mortality, it's more than 300,000 per year. And we look at Asia Pacific, which is one of our focuses, it's more than 85,000 per year. And the average maternal mortality ratio in the Asia Pacific is 127 per 100,000 births. And as you know, the SDG 3 wants to bring it down by 2030 to half of that, about 70 per 100,000. And we don't think that's going to be possible. In fact, the projection is more than half the countries are not going to make it if we look at the current healthcare resources and the current healthcare personnel. So that gap has to be bridged by technology. We're very focused on medtech, digital health, including mobile health, and big data plays, and using AI to crunch through that data to give us analytics and predictive modeling. So specifically in the journey, let's say, of a mother, right, in a reproductive years, one of the things we look at particularly is this gap in knowledge of medical conditions. Let's take cardiac care in mothers. A lot of papers and resources and drugs have been tested mostly on male patients globally, particularly in wealthy countries. And women's cardiac problems have been sorely neglected. One of our startups called HealthPals, by looking at large population databases, specifically from the US, but now also in Asia, Indonesia, and India, is looking at high-risk groups, including females with cardiometabolic problems, and gathering the data right now from community health clinics and centers, together with people on the ground, including NGOs, funded by philanthropic organizations and the government, and also bringing in this private funding as well. So the first step is to collect the data, crunch it, and find out who are at high risk in these rural communities, and then deploying limited resources to the high-risk groups. So that's what HealthPals can do for cardiometabolic problems. We have another startup called Winos, which has taken next-gen testing based out of $1 million machines like Illumina and compressed it into a point-of-care device where it is 1/1000th of the cost, so that we can do genetic testing very early on in mothers and also identify high-risk mothers quite early, high risk for breast cancer, for example, with specific genes, high risk also when they are pregnant, because we can find out trisomy from maternal blood, because the fetal blood also circulates in the mother. So that is one way also of identifying high-risk people quite early and in the community, because these are small devices that can be used in a community healthcare clinic. The other area we're very interested in is pregnancy itself. Pregnancy is a high-risk situation, even for a young female. And we know that it's important to monitor these mothers as well as the child during the pregnancy. So one of our startups, Biorhythm, has a medtech device which is small in form, sensors which are placed on the mother and can be worn 24/7, so that we can do remote monitoring throughout the entire pregnancy. That information can be collected through telehealth means, seen and displayed in a very simple dashboard, so that not only a trained obstetrician, but a trained midwife and trained nurses can get early information and call people in if there's a problem with maternal or fetal health. And then we have a very low cost platform out of another startup called Janitry, based out of India. Biorhythm's out of Singapore. HealthPal's out of Stanford University in the US. But Janitry is out of India. And Janitry, the founders have walked the talk. They've gone down to the village level and seen the problems on the ground. And they have built an amazing low-cost device that is 1/100 of the cost of a $2,000. It's called cardiotocogram, and it's used at the time of birth to monitor the fetal heart and uterine contractions. So any dysfunction in that information, you know the fetus is going to be in distress. And this can be also displayed. It's electronic sensors. We gather information. It can be displayed on a simple iPad-like device at very low cost. And that display can be used by trained midwives, nurses, and also remotely looked at by proper specialists. And after delivery, the other problem, of course, is not just high infant mortality rates in the Asia Pacific. I mean, to give you an idea of the staggering numbers, overall, 4.5 million infants die every year worldwide. About almost half those deaths are in the Asia Pacific. And most of those deaths occur at the time of delivery or soon after. So that intrapartum death rate can be significantly reduced by better monitoring. And even predictive analytics. As we get more information, you can then actually predict which mothers will have children at high risk at the time of delivery. Post-delivery, we have another set of problems, because again, the risk of death doesn't go away immediately after delivery. Most children who die in the first 28 days. And then we come into this issue of preterm children. Out of 150 million deliveries, live births in the world, 15 million are preterm. These are high-risk babies. We have a startup called Child Health Imprints, which does the inequalities, which is an intelligent neonatal ICU system. So they can monitor the children in the ICU, connect all these disparate medical devices, which are crucial for keeping the child alive, but don't talk to each other. Present it in a dashboard, crunch the big data, use AI, and again, alert the doctors and nurses very early on as to which child is getting into trouble. They can even predict now, 24 hours before an event, before a cardiorespiratory event, which child is going to have that event with 80 to 90% certainty with all the data they've collected. So that's already in all the major hospitals in India. Almost all the big private hospitals in India have it, and some of the public hospitals. So that we feel is going to be something quite impactful in the Asia Pacific and other regions around the world. Another issue that we think is completely overlooked are mental health issues in mothers. So mothers are going through pregnancy and after pregnancy have significant mental health issues, includes depression, anxiety, and what we try and do is get our startups to talk to each other. So we have a startup in the brain health, mental health space out of Singapore called Cognifix. They have a digital assessment platform which can be integrated into some of the other platforms, including, for example, Biorhythm, which does tell you remote monitoring of mothers, so that we have a very comprehensive understanding and metrics on not just the body, but the brain as well. So brain and body together. So this is a much more comprehensive view that we get of that person. So I think I've said quite a lot, and I'm very happy to answer a lot of questions because there are a lot of very specific technical details that people may want to know. I'm happy to share with them. Thank you.
Thank you very much, Dr. Prem. This was wonderful and a very insightful breadth of innovative ideas and experiences which are happening on the ground. I'm sure the audience will find it very valuable. I request the final speaker to come on board. Dr. Neeta, it's wonderful to be speaking to you. And it'd be great if you could help us through your experience, which USAID has had in these areas, to present your view on the innovative finance ecosystem and its ability to address the healthcare needs of women and the socially excluded. It would also be wonderful if you could also share the network collaborative platform USAID is supporting and talk about the role different stakeholders could play towards ensuring improved gender outcomes.
Thank you, Amrita. And thanks to AVPN for giving me this opportunity. It's both a pleasure and a privilege to be a part of this panel because there has been wonderful insights that I have got from different panelists. But before I answer your question, Amrita, I'd like to just take a moment to demystify some of the concepts that we are talking about, some of the common terminologies that we use, like innovation, innovative financing, gender empowerment, inclusive development. What does this mean? So when we talk of innovation, any means or any way of achieving the desired outcome better, faster, and cheaper is what is innovation. And when we use finance as the lever to achieve the desired outcome, it's innovative financing. And when we talk about gender, gender is not only about male and female or men and women, but it's also about the third gender. It's also about how men play an active role in influencing the gender norms, both men and boys. And when we talk of inclusive development, it has a host of other determinants, like the geography, like the socio-economic status, the class, the physical and mental ability, and all of this sort of overlays on the gender aspect, thereby increasing the vulnerability. And why do we need to think about all of this? Because somewhere they all need to connect. And to just give a little bit of context to that, in India, the labor workforce participation rate for women has been declining, and it stands at 26.9 as compared to 75 for men. And if you look at transgenders, 92% of transgender are out of any economic activity. So what does this mean? That gender actually is a very important part of the social construct. And if we keep a large proportion of the population out of the economic activity, the society has to bear the brunt of it. There is a huge economic cost that is involved because of this exclusion. So the McKinsey report states that if women were to work at par with men in the workforce, it would actually add to $20 trillion to the global GDP on an annual basis by 2025. So what does this mean? Increase in the annual GDP by 11%. So it makes a perfect sense for investors to invest into women impact innovations and activities. And therefore, gender equality and empowerment is extremely important. And as you well said, within Gates Foundation, within USAID, and I think a lot of organizations are focusing on the gender lens. But what does that mean? it requires a lot of political will, it requires policy advocacy, it requires community level mobilization, it requires a host of other factors that needs to be taken into consideration. And underpinning all of this is to make finance work effectively to achieve the desired outcome, especially crossing over the dimensions of gender equality and empowerment. So to simplify, what I'm trying to say is finance can be used as a lever to achieve the desired outcome by setting up structures and systems that could be incentivized either financially or non-financially. In simpler terms, it means can we incentivize access to capital for women-led enterprises? Can we incentivize innovations that offer solutions to the socially excluded? Can we incentivize the solutions that are led by women? So, it could be structures and systems that can actually allow the marginalized and the women to access the services better. So I'm trying to highlight on 3 dimensions. One is access to capital, another is innovations that are focused, and third is the systems that can engage more and more of socially excluded or provide services to them. And here, going back to your question, Amrita, in terms of what USAID has done. So USAID has a gender and inclusive development policy, and it cuts across all the projects and the work that we do. But here I would like to share some of the examples specific to innovative financing. So one of the examples where we are incentivizing the systems that can actually include the socially excluded group, and in this case, I'm talking about women. It could be actually met through outcome-based financing or a pay-for-performance model. And I'm talking about the Utkrisht, that is the Development Impact Bond, the first impact bond in the world, which is focused on maternal health. There we are using the grant funds from USAID and Merck for Mothers as outcome funding to incentivize the private providers to provide quality services to mothers and newborn. And it has a potential to save about 10,000 lives. And so far, we have been able to reach out to 100,000 women and newborns through the Development Impact Bond. So here we are trying to provide the risk capital to the private investors and also cover for the outcome verification cost. The other example that I would like to quote is the blended financing platform that we have on PEHEL. Where we have been able to mobilize additional resources for women-led enterprises. And one of the example is LaborNet, which focuses on livelihood issues for the informal sector. And the other one is Global, which has a network of healthcare providers in the private sector, ranging from tertiary care to digital primary clinics and linked through telemedicine. Another example where we have been able to mobilize philanthropic capital for adolescent through the Dasra Adolescent Collaborative, which aims at mobilizing $5 million over a period of 5 years to reach out to 50 million adolescents. So again, here the entire focus is to benefit the health, education, and agency building as the key factors among the adolescents. And so in all of these examples, what I want to highlight is we are using finance as the lever to incentivize either structures or access to capital to the women enterprise. And we have also recently launched the blended finance facility in collaboration with National Health Authority. And here we have huge opportunities of integrating gender and inclusive development dimensions. And some of the examples could be like, can we incentivize borrowing by women-led enterprises by providing them additional guarantees? Or can we use grant or philanthropic capital to subsidize the interest rates like interest subvention or loan buy down? Can we prioritize the customized blended financing options to women-led enterprises? So one of the examples I would like to quote here is Saral Design, which is an innovation on producing low-cost sanitary napkins. And this is being led by a woman, young woman innovator. And this is being supported through Millennium Alliance in collaboration with other partners. And with COVID, they have been able to use the same machine to produce surgical masks within a span of a week. So can these kind of innovations be supported through the blended financing? And definitely we need to look at innovations that address the needs of women or the socially excluded. So say, for instance, what are the challenges that a lady doctor or nurses or frontline workers face, especially when they are on duty? So can we think of menstrual hygiene products that could be integrated into the personal protective equipment? Like these are just some thoughts, but can we sort of prioritize financing to these kind of enterprises and these kind of solutions? So when we have a huge gap of financing to meet the requirement of small, medium, and micro enterprises led by women, which is to the tune of $158 billion US, when we have huge gaps in health outcomes, when we have huge challenges in the health system, it actually merits all of us to come together and collaborate together. And in all of the examples that I have given from USA, we are not doing it all by ourselves. We have a lot of partners in this, in the entire effort. And here I take the opportunity to share about the health platform that USAID has launched along with AVPN and BEHEL. And we are glad to share that we already have huge interest and partnerships from this platform. And I would encourage all the participants to further on enroll into this platform. I also urge all the participants and listeners to visit our Learning for Impact site, which has a resource guide on inclusive development, and actually access this, and you can also contribute. So it's a sort of a repository on tools and guidelines. So it's more of an exchange platform, and it's extremely important for everyone to come together and pool the resources. And going back to your question, Amrita, on what are the different roles that stakeholders need to play, and how do we ensure gender outcomes? I think going back to the point that Tom made and Prem made, that we need to focus on the outcomes. Because what gets measured is what gets done. So it's very important to have very strong metrics. And in this, there are different roles that different stakeholders can play. The other important aspect is to have adequate representation of women across all the categories, across all the levels. So when we talk of innovative financing, we need to have women as aggregators of solutions, as innovators, as decision makers, like being a part of the governing board or the executive committee, which takes decision on who should get the funds or the resources. And the third important point that I want to state here is every stakeholder has a very important role to play. And if we can harness their capacities together. So for instance, government has a very important role to play in terms of policies and gender sensitive programs and scaling them up. Philanthropists can actually bring in risk capital to encourage private investment for gender equality and women's empowerment. And when we look at private corporates, they can actually set examples with having senior leadership, representation of women at the senior leadership, having conducive workplace policies, and coming up with innovative solutions for larger developmental issues and problems. And last but not the least, I would like to state that without women's empowerment and inclusive development, we will not be able to achieve better health outcomes. It's extremely important for us to have robust health systems, as well as economic development in the country. Thank you, and I'm happy to take more questions.
Wonderful. We've had excellent panel participation. I want to thank all the panelists. I have learned a lot. three key messages which I have taken away is it's important to always understand the grassroots context of what the need is, what is the on the ground situation, and all the panelists spoke about it. The other one is the data and evidence, which is needed to see which models are working, which models are scaling, which models are not. And the last one is really linking payments to outcomes and using that as a way to sort of drive scale. We already have a lot of questions which are coming in from the audience, so it'd be great if we can move to that. And moving to the Q&A session, the first question we have from our audience is really around, is there an appetite among grant makers and investors to focus on outcomes? This often means working with structural and systemic issues and patients to see outcomes being achieved for 5 to 7 years. So Neeta, you already spoke about this, and you mentioned in very concrete ways how USAID has is moving towards outcome-based payment measures. Do you see that critical element of this being the patients required to stick with those outcomes? And do you see this as a movement which other stakeholders and other financials are also moving towards?
Yeah, so the progress in that direction is pretty slow because I know everyone wants to see outcomes at the earliest. But what we have realized is you can have intermediary outcomes, and instead of waiting for the final impact or the results, you can actually set milestones and look at the intermediary outcomes. And if that satisfies the investors, I think that that's a good way to go forward, because as we all understand, in development sector, to actually see long-term outcomes or impact really requires a lot of patience and a lot of time.
Wonderful. So Tom, the next question is for you. Impact metrics is something which you spoke about. How do you know evidence that something is working or not? And they're very important to incentivize investment and encourage greater financing in these issues. However, seeing that impact can take years, something which Neeta also just spoke about, how do you suggest that we track progress and identify tangible midterm outcomes?
Thanks, Amrita. Maybe I combine the two questions into one answer. I mean, what Dr. Neeta said is true. On the other hand, if I take an example from India, from the education thematic around the impact bond that educate girls, that were like the intermediate outcomes measured were on learning outcomes with these children in public schools in Rajasthan, were extremely important to fine-tune the curriculum in order to actually achieve the ultimate outcome. So I think if we talk about quality, and it's really important that we know what we mean by quality, and that we measure that as soon as possible in order to really like fine-tune or improve the service provision in healthcare, in education. So I think if we don't move to that level of diligence and proficiency, then we will continue having solutions that don't tap into the full potential of impact. And I mean, in our engagements that we use a different set of indicators. I mean, when we think about the long-term outcome or impact that we want to achieve, how can we break that down? We have a theory of change. We try to identify different proxies for impact that we can measure. On an ongoing basis, because I think while very rigid research is important, it's equally important to have more rapid access to data to spark that and to fuel that innovation engine that we were talking about, to constantly learn and improve from what's working and what's not working. So that's why I think outcomes are, it's not an option for me to think about, do we measure outcomes or not? It's more like the way, how can we use intelligent and frequent and robust measuring systems to continuously working towards improving these outcomes.
Great. Thank you, Tom, and for answering both the questions. So Dr. Prem, one of the questions which the audience would love to get your views on is, what have been the problems related to women and health issues which have been identified during COVID-19? We know that most of the impacted population seems to be elderly men, But it'd be great to hear your views on what have been the additional discoveries in relation to women's health, which has come through in COVID-19. Dr. Prem, you're on mute.
Yeah, so the biggest problem we have seen with COVID-19 as a whole is neglect of non-COVID problems. So what we have seen in the major hospital systems worldwide, here in Singapore, in the United States, even colleagues in India tell me they see that as well, is that people are not coming in for routine checkups. So they are not getting the routine follow-up checkups they need. So obviously, if you have a mother who's pregnant and she's too afraid to go to the hospital, we have not deployed these systems, the home monitoring systems yet widely. Even in Singapore, we haven't deployed them very widely for pregnancy yet. So people only come in when things are bad. So we are still collecting data, but the impression is that, for example, heart attacks, we just take heart attacks and strokes. People are not coming in, so we expect that the mortality rates and disability rates are going to increase. I can't tell you specific figures right now, but this is the worry right now, that there's a lot of neglect of normal routine care during this period.
No, that's so important, Dr. Prem, and we are seeing this across geographies, and it's very worrying. Neeta, the next question is for you. You mentioned that USAID has been providing additional resources for women-led enterprises. Could you please elaborate on the same? Are there fixed parameters, matrices, or eligibility for such enterprises?
So while there are no fixed eligibility criteria, we just through the innovative financing platform, we just keep an active search or an eye for women-led enterprises. But this is a good thing, and we have been thinking of including those parameters, and going forward we will be doing that. In terms of what is the support that is provided is actually a lot of capacity enhancement in terms of developing business plans for these enterprises and making presentations to investors. So those are the support that is provided. Also at the field level, there's a lot of technical support provided. For instance, how do we enhance the telemedicine services in the digital primary healthcare clinics? What are the services, and how do we strengthen the outreach services to the community? So those are the kind of technical support that we provide.
So Tom, so has the COVID-19 situation, in your opinion, made the ecosystem more conducive towards innovative financing, or has it made it more difficult?
I don't know. I think it's too early to say, because most stakeholders that we engage with are very focused on coordinating the response to the current pandemic. I think right now I have discussions with USAID in West Africa on education. I think at the moment it's definitely more difficult to progress on these conversations. Things that are already in the making, because priorities are shifting towards the pandemic response. Overall, I think it's too early to make a conclusive answer on that. But maybe one thing that I would like to add, what Dr. Prem said around the COVID consequences. I think when I think back, and there is a study around West Africa when Ebola hit the region, that actually there were more casualties and death due to the basic stop of primary healthcare provision in these regions than through Ebola itself. And I think that's right now, I see it very similar, that the lack of traditional primary healthcare provision due to the lockdown, due to the problems that healthcare workers cannot reach the first mile. Actually, I like that. I always thought about the last mile, but it's actually the first mile. Therefore, when you look at it from a client perspective, that these things fall away right now, and And that, I think, will be critical. And that's where technology comes in again. It cannot solve all these problems, but at least it can bridge some of them. Sorry for answering again a different question.
No, this was very interesting. So I think we are on time. I don't know if we have time for another question. Kavita?
I think we'll not be able to take any more questions.
I'll hand it back to you. Thank you so much to the panelists. It was wonderful having the session with you.
Thank you all of the participants who put in such good questions, and thank you panelists who answered them so well. But before we end the session, we have one final poll for all the participants. After listening to our speakers, we would want to know how would you like to collaborate, engage with others working on gender and innovative financing? You can actually choose multiple options. And would you like to join the AVPL PEHEL health platform supported by USAID? If you say yes, we will reach out to you with the details. And would you like to know more about the AVPN gender platform? Again, if you say yes, we'll reach out to you with the details very soon. This is fantastic participation in the polls by the audience. We would like to let you know about the AVPL PEHEL health platform. In case you want to know more about it, kindly visit the website and you can learn more about it. I would like to thank you, Amrita, Dr. Prem, Dr. Neeta, and Tom for this excellent session. And thanks all of you to the listeners and the participant. We now have come to the end of the session. This session was made possible with the kind support of our lead partners, Stockholm Environment Institute, Chandler Foundation, and Gidan Prize Foundation, and our knowledge partner, Ford Foundation and Sasakawa Peace Foundation. To continue chatting with your speakers and fellow delegates in this session, please make full use of the AVPN connector. The link may be found on the chat very soon. Do share your highlights of this session on social media and remember to tag us using the hashtag AVPN2020. We would also invite you to explore our new prototype online learning platform, the AVPN Academy at academy.avpn.asia, and our events platform for our upcoming webinars for impact funds and family offices. We would love to hear your feedback on how we can make this platform more useful in your learning journey. We would also be very happy to explore collaboration opportunities to create new courses and content for the AVPN community. In the meantime, please join us at the next session, interview with Julie Ann Guerra, DFAT Ambassador for Gender Equality. The session starts at 5:50 p.m. SDT. We look forward to seeing you there. Thank you all of you for joining.
Thank you and goodbye.
Thank you. Bye.
Thank you.
Thank you. Goodbye.